Are you a woman experiencing pain or discomfort with intimacy? Well, just know you are not alone. So many women deal with this. And in this video today, I'm going to talk you through what some of the causes may be and also shed some light on how you can finally get some relief by giving you some simple tips. And it's important to know that you don't have to live like this. There is hope, and you shouldn't have to have discomfort or pain during intimacy. So I want you to realize that there are some simple strategies to help you. My name is Dr. Dawn Andalone. I'm a pelvic floor therapist and physical therapist that works a lot with women with pelvic floor conditions. So having pain during intimacy, one of the most important things to say first is make sure you've been cleared by your medical doctor that when you go in for a screening or checkup, that you mention this and any red flags are screened to make sure that something that you may not realize is causing it. But if your doctor maybe gave you some guidance like just go drink a glass of wine before you get intimate or just relax, those things are not going to help you, and I can explain why. And it can be very frustrating for women that have very uncomfortable gynecological exams and can't tolerate it. Well, those muscles down there are very much related to why things hurt and why it's painful. So once you've been screened by your doctor and you don't have any other big major red flags going on, then it's important to understand the pelvic floor muscles and why this might be happening. So these are the muscles at the bottom part of your pelvis. I show this a lot in my other videos so you can understand their missing link and why any other muscle in your body, if it's tense or holding a lot of unnecessary tension there and is shortened in a shortened state, then that is going to create a pain cycle. And in those muscles, like in your back or your quad or your hamstring, if you're holding tension there and the muscle's really tight, then it can be difficult to use it in a normal fashion and also have pressure against it. It's going to be uncomfortable. So what do we do in this case? Well, there are stretches, there are exercises and yoga type poses that can be very helpful to release those muscles, and also ways that you can get your brain to connect to your nervous system so that way you can ease those muscles and learn how to let them go. Because oftentimes when we're under any kind of trauma, emotional stress, physical stress, or we have a chronic condition such as endometriosis, PCOS, interstitial cystitis, if you've ever heard of any of those, it is very common to the muscles respond to any of the pain that's going on or discomfort by holding that tension there. And therefore, it can be very painful when you put in a tampon or you're going through a gynecological exam or trying to be intimate with your partner because those muscles are holding tension and uncomfortable. So what can you do? So your nervous system, let's talk about that. When you're under any stress, just your subconscious brain from there is going to have this physical connection between it. There has been a lot of research around this and other people that study this as well, and what the physical part of your body does when you're under tension and under stress. And for women, we tend to hold a lot of our stress in our neck and shoulders, up in our jaw. Maybe you're experiencing TMJ problems or migraines or headaches. And even that is connected with having a lot of unnecessary tension in your pelvic floor muscles too. So for women, I see this all the time, that we start working on releasing the tension in their pelvic floor, and therefore their headaches go away and they stop having any kind of neck pain. So it is closely related, and a lot of people don't realize that as well. I'm going to talk you through a few simple strategies of things that you can go back and watch some other videos that I have in regards to doing exercises for the pelvic floor. But I think you need to pay attention to what is causing unnecessary tension in those muscles down there, because that is usually the cause of having pain during intercourse or pain during intimacy. So I'm going to take you through a few quick tips of things that you can start doing on your own to help release some of that tension in your pelvic floor and see if this helps ease some of the pain and discomfort that you're having with intimacy. And it's important to note that if you're doing these consistently, say once or twice a day, and you do them over several weeks, it can make a big difference. It's not just a one-time thing, but they need to be done often, and they need to be done over a series of weeks for it really to make a change in the muscles and also affect you to understand and really get your brain to connect to that area. Now, being guided by a pelvic floor therapist is going to be the best way, but try these things first. So you can go on your back with your knees bent, and you're going to go through some simple breathing exercises. I do a lot of videos about breathing because it does impact the pelvic floor and allows you to use your diaphragm here to affect your core and your pelvic floor down here to let those muscles go. You want to imagine that you're inhaling through your nose and exhaling through your mouth, and imagining the pelvic floor, the muscles in the vaginal area, that you're opening up those muscles like a flower opening. You don't want to bear down and push out at all, ever, when doing these kinds of exercises. You want to just think of a gradual letting go. And if you're not sure if you're doing it correctly, you can even take 2 fingers and go right along the outer edge of the anal area, and that way you can sense and feel your pelvic floor. Is it letting go, or are you holding contraction and holding tension there? If you try even a small little Kegel exercise first, just recognize what it feels to tense them, and then do the opposite and just let it go. We're gonna do the breathing exercise with no contraction, but you're just gonna breathe in through your nose and out through your mouth, and take 10 deep breaths. And notice, are you clenching your butt muscles? Are you tightening your abs? Or can you let everything go? And on your inhale, you just imagine that flower opening, or opening through the pelvic inlet or your vaginal wall through there. So no bulging, pushing down. You're just doing some simple breathing and allowing those muscles to let go. So that is the first thing. The second thing is a figure 4 stretch. So I'm gonna cross my ankle over my knee, and I'm reaching through my legs to pull that thigh toward me. And this is really gonna open up that part by your glute muscle and through your pelvic floor muscles real deep in there. So you are working on externally rotating your hips and opening up those muscles, because they may be really tight through your hips, and that affects your pelvic floor. So you can hold that for 20 to 30 seconds and do that 2 to 3 times on each side. The next exercise is a butterfly stretch. So you are sitting with your legs in a butterfly position with your feet together. And if this is really hard for you, then just do one side at a time, because you're still going to be opening up and rotating out through that hip on one side. I'm showing with both sides like a butterfly stretch, so you can use your elbows, just press down gently and lean forward. So you're really working on opening up. If you feel like you're really holding a lot of tension there, just go real nice and gradual and work on your breathing at the same time. So anything that is working on stretching your muscles and externally rotating your hips there, even going into a real deep squat and doing some breathing there. Maybe you take a yoga class or a restorative yoga class or a yin yoga class is great, because they're going to be holding the poses and affecting your fascia and your muscles to be able to let go and release, and focusing on breathing. So I find that those things are very helpful for the women that I see. And if your problem is not getting better after a few weeks, you definitely want to talk to and consult with a pelvic floor therapist, because then that way they're going to be able to get to the root of the problem a lot faster for you and solve it. So no one should have pain with intimacy. It should be very enjoyable for you. And having tension in your pelvic floor muscles can be a huge missing link to why this is not getting better for you, or your doctor hasn't explained to you in this way. So I hope that helps, and please hit subscribe if you want to learn more about any kind of women's health topics. I talk a lot about pelvic floor conditions on this channel. So if you hit subscribe, then you'll be notified of new videos when they get released every week. Thank you for watching. And once again, make sure you're cleared by your doctor first, and then try some of the things in this video, and I hope it helps.